It's on.
All right. Hi, everybody.
So our last update was this past Monday evening, and at that point Ray had been at the hospital with kidney stones, which still have not completely passed. So he's been dealing with that all week long, on and off some pretty heavy narcotics and pain medication and anti-nausea medication. He's been pretty sick, and so Jaymon was delayed. He was supposed to come back here on Monday, which again, it was kind of a big surprise. He was supposed to stay in that facility until they found placement, but for a whole variety of reasons, he had to come back. And so Community Mental Health actually went over and got him on Tuesday. They took us.
Yes.
To
They
get
assisted
him.
us in picking him up because
Right.
I had just spent half a day in the emergency room and was on narcotics, and they sent me home with those, and so I have been an unwilling participant in those for several days now, still waiting for this to pass. So yeah, so at any rate, they did come to the rescue and drove. It was a 6-7 hour trip.
Drive. We got home late Tuesday afternoon.
Yes.
And the behavioral hospital, they weren't going to keep Jaymon 1 second longer than they needed to. They were not happy about it at all that we had to delay it even by 1 day. So
Right.
yeah.
Right.
And there's a fire going behind us.
Oh,
It's smoking,
yeah.
so that's why you're seeing the smoke. So anyway, so you want to pick up from literally
Well,
5
yeah.
minutes?
So
He was a
they
little
assisted us
agitated in the
Wells-
way home.
Yeah.
A little agitated,
Um,
but a few things that I was sitting in the. He was in the far back of the van. I was right in front of him, and I had to calm him down a couple of times. He started to get upset when he talked about writing things down.
Yeah.
Suggestion box that we
Yes.
come up with. He didn't like that, and I had to settle him down. But that didn't seem anything out of the ordinary.
No.
So
So, but within 20 minutes of us getting home, he
5
wa-
minutes, but within
5
20
minutes,
minutes.
really, yeah. So he had actually done some throwing and spitting behavior. So
Within 20 minutes.
yeah, and that actually continued, and his intermittent explosive anger basically became continuous explosive anger and rage for 2 days.
Yeah.
And we had the police over twice in those 2 days, and yesterday morning then it required me to restrain him on the floor until the officers got there, and we were able to get him a commitment to not act out from there. And I had been talking to him and instructing him that this wasn't his fault, that he needed to still try as hard as he could, but it wasn't his fault. Nobody was mad at him because his medication's been mismanaged and misprescribed, and this was not my son. This is not the son that left the house at 18 years old, and so that needs to be explored, regardless of what the suspected reason is. And he is on a number of medications. So yeah, go ahead,
If you
Kim.
don't mind, I'm going to back up. So when Jaymon got back, the neurological behavioral hospital took him off all of the meds he had been on, and which some he absolutely needed to be off of, and then put him on a whole host of new medications. One of which those medications that was supposed to follow Jaymon was Valium. It's to control any violent behaviors that might be starting to erupt, and that might try and get it before he escalated.
And this was in the menu that they were
Right.
giving him at the
Right.
hospital.
And so on the way home, they transferred all the meds to the pharmacy. And the pharmacy, Fred's pharmacy, is wonderful. They put it in bubble packs. So it's very clear on what time and what meds. It's just already all bubble packed up. And so there's really, no extra work involved with that. You just give them those meds at those times. But the last one was the Valium, and it was prescribed as needed, 3 times per day as needed. Well, because it was as needed and didn't go in the bubble pack, the pharmacist did that last and didn't get to it because that was
It was separate.
From Indiana to Michigan, you can't just have an Indiana doctor write a prescription to fill in
For
Michigan. So
controlled
that was the
substance,
last one
yes.
that didn't get transferred over.
Mhm.
So we didn't come home with Valium, or we may have started to use that. But Ray had decided. You want to tell him what you did?
Yeah,
He
yeah.
decided to just
I tried
basic CBD.
5 drops of CBD oil, and it didn't really start to seem to have an effect until the officers came in, and from kind of that point forward,
Right.
and on
So-
the ambulance ride over to Coldwater. Well,
Yeah.
actually, he actually allowed all of the officers and the EMTs that came in after that to just be supportive of him. He I don't know. I just kept repeating because I think fear is a big part of this. He doesn't want to go to jail. He doesn't want to be arrested. And those have typically been inappropriately used to deal with his behavior.
So
So,
Ray had
yeah.
we had decided he had become more dangerous,
Mhm.
more violent than he was before he left.
Yeah.
And unmanageable for us. And this was dropped on us so quickly, we didn't even have time to prepare how we were going to split up and where we were going to live, and all of that, even had time to prepare for any of that. And we decided, okay, plan A, plan B, if he got violent. But it all happened so quickly. Even the last couple of days happened so quickly, we didn't know what to do. So Ray had decided, well, we couldn't get the Valium transferred. They were dinking around between the med clinic and everybody else, that and the doctor, on not wanting to actually fulfill that prescription here in Michigan until they saw him, which was
The
sometime next
CMH
week.
psychiatrist, yes,
Yeah,
of course.
and so the actual doctor did finally prescribe it. However, in between, Ray said, maybe I'll just try a tiny little bit of microdosed CBD and see if it worked. And he had a major violent episode on Thursday.
Before it really had time to.
So he had one on
yeah,
Thursday, and so
yeah.
Ray decided to try it Thursday.
Yeah.
And after the police had left, I was expecting the police to take him and transport him over to the hospital. But they didn't. They left him here. And so it was Friday morning. Ray decided to go ahead and try in just a little bit again, since it did seem to make Jaymon mellow. It made him sleep. After an episode, he usually sleeps.
And that's not what we're looking for.
We don't want him.
So
We don't want him on Valium. We don't want him.
We don't want him sleepy.
sleeping
He
all the
wasn't
time.
sleepy when he left the
But
house.
we
He
knew
was.
these
Yeah,
meds
yeah.
were not correct.
Yeah.
He came home. Let's see. He had less impulse control. Ray had said that he'd regressed, right? You want to?
Oh yeah, he'd actually what I was seeing was a regression to adolescence, where during that adolescence he was having 3 major episodes a day that required restraint, and that went on for years. And he
so he
didn't
regressed back to that.
Yeah, he didn't start maturing out of that, and there was a maturation process that happened naturally. But with autism, if it happens at all, it's just so delayed.
And so the irrational thinking, he's already irrational to a certain point because he's developmentally
Impulse
delayed.
control.
So we'll give a few examples. One was the microwave.
Yes, for instance, he became very upset, agitated, because we were cooking for something for him in the microwave, and he wanted to eat right now. And normally he would understand the time concept and even watch as the time go down, but that even short-circuited, and so he is like a little white Hulk, and what he was like that as a child, running around, and he as a adolescent, he ran up and down the kitchen and broke the tiles off the floor, stomping through the kitchen. That's the level of damage he can create just from his mass.
Yeah.
His bone structure. He headbutted a security guard at the place and sent him to the hospital.
Well, at the neurological behavioral hospital. And I will at some point go through and do little snippets, and I learned to edit a little bit, but snippets of what the house of somebody like this looks like Ray said. there's no tile floors. There's no floors in some of the house at all as far as like a finished floor, because it just gets ruined and damaged.
Yeah.
The house, you can tell this has been a behavior home for all of these years. But Thursday the police came, and it was an issue with his blood sugar. And it wasn't an issue with his blood sugar. It was Ray had said, "Hey buddy, go ahead and check your blood sugar because it's time for lunch." And Jaymon lost it.
Yeah.
And he literally spit right on Ray, and he's like, "I already told you, mother effer." And normally, if when Jaymon has his meter and his sensor in his arm, his meter is like anyone else's cell phone. He doesn't have an electronic device, so he's very obsessive about constantly checking his blood sugar. It's the only little electronic device he has.
Yes.
And he's always checking it, and he's always announcing what it is. So usually when it's time, and unless it's alarming, which the alarms will go off and we will know, Ray kind of, he'll say okay, but he doesn't always register it because he'd be registering it 400 times a day, in his head. So Ray's
and I don't recall him telling me.
And
anyway,
so even if Jaymon did, so apparently Jaymon had checked it at some point.
Yeah.
And according to Jaymon, even if he had checked it 2 hours earlier, to him, he had checked it, not, what he needed to. So Ray always makes sure that his blood sugar gets checked.
But it was a routine
appropriate
question.
At the appropriate time, nothing had changed, and that set Jaymon off. And next thing you know, I mean, and he picked up his meter and threw it at me, and it smacked me. And I had been across the room. I had made a point to never be in the room when Jaymon was anywhere around. I was going back to the hiding in the bedroom and closet and bathroom, and they had, and Jaymon had just come out and sat down, and I mean, it was that quick that I got smacked. And I had my glasses on. I mean, imagine if it hit me here in the chest. Imagine if it just hit me in the eye. And I had got out of the room so quickly, and Ray said, "Call 911," because he saw it was escalating so quickly. And I realized my phone was on the table. So in the time,
she didn't see him pick up a frying pan.
No, I
couldn't get the words even out of my mouth quickly enough.
And I stepped in and grabbed my phone, and just in that time frame, he picked up a heavy. He's not supposed to be in the kitchen at all, and he picked up a heavy duty frying pan and threw it. But we didn't even realize it till later, and we'd gone back and actually watched the footage.
Yeah, I turned to look at you and warn you, and couldn't get the words out of my mouth, and you'd gotten out of the way. But by the time I turned back, somewhere in that, the pan had passed between us.
Right, and it didn't hit anybody, but that's how quick it all happens. And just in the time I grabbed my phone to call 911, and you would think that you don't ever get used to this, but you would think that you're still more prepared. But it all happens so quickly. And this time around with Jaymon coming back, it happens in the blink of an eye. So yesterday, and we do, I do have a tendency to try and put record on my phone anytime anything happens. And now we had ordered a recording device that's on 24/7. And it's only audio, but it at least catches everything, just for liability and safety. He's not supposed to be here. He's not supposed to be taken care of by us, and so just for liability. And then Friday, Jaymon wears special orthotic diabetic shoes, and the doctor made it very clear he's always supposed to wear the shoes unless he's in bed asleep or in the shower or swimming, And Jaymon had followed that rule for years without a problem at all. And then, here he is. He'd been a little argumentative about it. He came out Friday from his shower, and he had on a pair of sandal slippers. and Ray had mentioned, "Hey buddy, doctor said you're supposed to have the shoes on." That was it. That was the end of it. There was a major episode. I got myself out the door. Police came. So when the police came, the whole point was to have him transported back to cold water. And so you want to pick up the story from there?
Yeah, so we had him transferred back to Coldwater, and he actually was just a trooper on the ride home. Excuse me, I'm sorry, got distracted on the ride to the hospital. He got up and talked to the officers and walked out to the ambulance and allowed them to check all of his vitals and and strap him into a chair, and both of us, we took a ride over, and he actually just was fairly compliant about the whole thing. And through my coaching, I guess, of him and letting him know that he understood, I guess he's under the enough. He has enough understanding to know that his meds aren't right. He doesn't. He knows how he used to think and used to act, and I think he has a grasp of that, or a memory of that, if you will. And so when I'm telling these things, I think he trusts me overall, and I ask him to make sure that he does trust me, because I am doing my best in spite of the uphill battle with information, with trust with agencies and people, and the quality of their work and the level of their care, and it's just a sad place to be. But anyway, I sometimes the only way I can get up in the morning is to fight his dragons. I don't even have the energy to fight ours. and that's just sad. That's not how it should be. But anyway,
Are these the right ones?
Yes, thank you.
Ray is passing kidney stones, and so he's had to take some pain meds, and he just wrote me a note that he needs them now. So,
thank you.
But yesterday, Ray rode over in the ambulance with Jaymon, and he's at the hospital. Next thing you know, he starts passing a kidney stone. I'm like, well, he's at the hospital, so he checked himself in there, and they treated him. It still hasn't passed yet, but they treated him while they were treating Jaymon, and fortunately, they actually admitted Jaymon into their psych ward. Last time they didn't do that.
Yeah.
We were prepared for Ray to be there another 3 days, 5 days, 30 days. We had no
Yes.
idea how long it was going to take.
And the way they did it was very professional, very comforting. I will back up and say I'll give a kudos.
Oh, there was a nurse.
Yes, I'll give a kudos to Kim at.
Is that her name?
Yeah, that was her name.
That was easy to remember.
Yeah, so that was easy to remember. Normally I wouldn't.
Yeah.
But she, a young nurse there, and Jaymon, when we first got there, he was still very non-compliant, and they actually changed his medication, I think, right away there. But before that, this was in the morning, he took a swipe at me, took a punch at me, and knocked my glasses off my face, and
right in the emergency room.
In the emergency room in front of her, and we were actually in our room. So, she was on him. She was on him like an old school marm. Yeah, she was about ready to light him up. No, actually, she handled it completely professionally, and she told him what was expected, and gave him and redirected him, and just with the perfect amount of authority. And at some other time, that might not have worked, but it was still the clinical,
well, and us here at the house trying to enforce rules like that, if I were to talk to him like that, I would have been injured. But because it was a nurse and because it was a hospital, now, again, send him home with her for 6 months, he'd probably, if his meds aren't straightened out, if he's not getting treatment, not the right treatment. And he was on meds that apparently he should not have been on at all, that Ray found out pretty quickly. And I think we'll post a video with questions directly to the Neurological Behavior Hospital, because we're not getting any answers from them. Right. They've refused to talk to Ray. The doctors refused to talk to Ray. We're trying to find out what Jaymon's baseline behavior was when he left, and we can't get any information. Were they giving him the Valium? Were they not? We don't know anything. Yeah. And not only that, again, they put him in intensive care. We have no record of blood sugar. We have no record of the insulin, any of that kind of stuff that he was on. No record of any of the meds. The only way we found that out was because it's what we picked up from the pharmacy, and they had communicated it to the pharmacy. And they had not given him his allopurinol, which has caused major issues, and I think we talked about that before. But the other thing that you noticed last night when he was going into, when they were admitting him, what did you notice on his head?
Oh my goodness. Well, Jamin, always struggled since he was an adolescent and a teenager with dry scalp. So we've always had medicated shampoo for him and all the group homes, and that stuff chases him around everywhere. And we we don't get the cheap stuff. We get the brand name stuff with the highest active ingredient in it for that purpose, and it seems to maintain it.
Now,
But
even if he's not using that, regular showers and regular shampooings will keep his head clean. It would just be a little bit itchy. So
yeah, and maybe a few flakes.
That's it.
Because that's how bad it is, even with the daily treatment or even intermittent treatment.
So you noticed.
So yesterday in the hospital, underneath the lights, and I'm standing over sitting in a hospital bed under these bright lights. He's just got these patches of scabs of dead skin on his scalp, and like scabs. It's almost and red spots, tiny little red spots. It's almost like little bites. But I couldn't find any eggs. I couldn't find so
because I didn't see it, but when you described it, it's almost more like cradle cap. That means anyone would know what that is. But he had not been. He had not been taking showers. He'd not been washing his hair.
Right.
He hadn't been obviously using.
And I've been asking for that from the facility
for 40 days.
For them to let him take a shower.
The whole time he was in the hospital, the other hospital, he hadn't taken a shower in a week. So we don't, and he was refusing to even give up the information on how many showers he did or didn't take
he
because
doesn't
he was
remember
afraid he was going to get in trouble.
The days are running together.
When he would call you every day, you're like, "Hey, did you take a shower today, buddy?" And he was just like, "Nah." But he didn't even want to talk about it because he was afraid he was going to get in trouble.
Right.
So he's always been agreeable to take a shower.
Yeah.
So that's not something that they would have had to have forced him to do.
Oh, he's been eyeing him. He was eyeing him in the shower.
Oh, he even said, "I'm so glad to have my shower."
Oh, yeah, you could hear him.
Yeah. So, we that's another neglect. That's insane. That's absolutely insane.
Yeah.
So, and then
he does appear to be in good hands. I spoke to a pretty large, well-kept young man who took all of my information, had me sign all the papers, and gathered all the information about really the direction as his guardian. The frustrated place I am, wanting to basically do a med reset or get as close to that as we can immediately or as quickly as we can without causing him harm. And then
you see what you're starting with.
Right. And then let's try some of the available non-invasive treatments, neuro-optical therapy, or even there's even 2 medications now that are FDA approved that are geared specifically towards autism or opening up the frontal cortex, activating, charging the electrically charging the frontal cortex.
Well, he's got to be safe. He's got to be safe in society. He's got to be safe.
So we got to do that
for
first.
Caregivers.
Yes.
He's got to be safe.
Yeah. So his level of care is number one.
He's got to be safe
because it's Jaymon can't control his behavior right now, at least under any medications that he's been on since he's left. And he did have a period of 6 months before that where he was episode free. Yeah. And so that was a testimony to his hard work, maturation, and the work of the team. He was student of the year. He did a commercial for on the Three River Sturgis radio station that we can actually play for you sometime.
Yeah. So do we want to wrap this up, and then we'll just stop this, and then we'll make another video about what the different scenarios of what could happen next, and actually ask the world for some advice here, right?
Yeah.
Can we do that?
Yeah.
Okay. All right. We'll be back in another video.